The Community Health Center of Buffalo is a federally qualified health center. Actually, these health centers began in the 1960s as part of the civil rights movement to actually be able to give health care to those of us that were underserved, poor, and didn't have access to health care. We are one of probably 1,700 in the country. It started in 1999. I came in 2006. We were very young. In fact, we were on the verge of closing. So when I came on board, we were struggling. Fast forward, we're now 6 sites, 20,000 patients, multiple different languages from all over the world, and very, very community-based. I've always been an activist by nature. Even when my children were growing up, I was part of Parents for Public Schools, always advocating for those of us that needed it the most. So when this opportunity came, I was actually the Vice President of Operations at Niagara County Community College at the time. And when this opportunity came up and they needed an executive director, part of it, I was, like I said, I was a therapist for 10 years in psych and med surg. Then I went into higher ed for 15 years. So when this opportunity came, I was able to put those two different opportunities together in my experiences, and here we are. Each health center is different. We might have the same purpose, but when you come to one health center, you come to one health center. So when you're talking about the health center, our health center in Buffalo, we don't use being in the community as a slogan. We actually live that. So these health centers tend to take on the pathology of the communities that they sit in. So I know that you know the mechanics of your job, but I need the spirit in which you work in the job. Those are two different things. So when I'm looking at the importance of delivering services to the community, I'm also looking at the spirit, because we're disproportionately, African Americans in particular, die disproportionately because of either poor health care, our environment, structural racism, you name it, we're impacted by it. Where you're sitting right now, we're 12 years to dying earlier than another zip code that's maybe 5 miles up the street. So when you're looking at these health centers, you're looking at providing a service that is survival, but you also want us to live. We don't want to just survive, we want to be able to live. So if you don't have the proper health care and get the proper checkups and prevention, then this is where we are. When you sit in these seats, you don't really understand the role and the impact that you have until you're in it. I've grown tremendously. I grow each and every day. There is no end goal. There's a difference between passion and purpose. My passion is to make sure that my community is uplifted and I can give the best I can. My purpose right now is through healthcare services. So I'm not going to stop giving and stop working to make sure that I can impact as many people and many lives as I can.